So from a recovery point of view, I guess that would be the next kind of question the patients really ask with otoplasty is, what's the downtime? Is there pain involved? Can I sleep comfortably? When can I lay back on my ears and things of that nature?
And that varies for each surgeon. Our preferred technique is we actually are pretty accelerated in terms of how quickly they get back to normal life. We put a dressing on around the ear that puts pretty intense pressure over top for one night. It's not really painful, you just feel like you have some pressure, something that's squeezing on the ears themselves. That comes off on the first day. And then after that, you'll look and see right on day one, it actually looks pretty good. The ears are in good position. Most patients are really happy already with the overall shape, but the ears themselves can look a little bit pink, a little bit swollen, mildly puffy. There can be a minor bruise behind the ear, but we don't generally get much in the way of bruising, and they're relatively presentable soon after surgery.
Yeah, and beyond that, we ask patients for the most part for that first week, night and day as much as possible, to wear some sort of headband that kind of holds the ears in position and gives them a sense of protection and comfort. It's really important not to grab and pull on the ears in those first couple of weeks. After that, it's really just for one more week at nighttime when we want them to wear those sorts of headbands. And from there on, they're pretty free. I think originally, and something that patients really want to know is, are they going to look overly pinned? Is that something that's of concern? Is there correction that happens over time? What happens with that?
Yeah, I think the two main concerns that most patients have are that it's not going to be corrected enough and they're still going to have outstanding ears, or the reverse. They've seen people who have it done that look like they're overcorrected and the ears almost look directly stuck down or pinned down to the head. Again, I think that's a function of the particular techniques that's used, where the surgeon just can't be very precise about what kind of result they're going to get. The way we do it, we're not removing too much skin, we're not pinning the ears too tightly down to the head. There's very little loss of correction that happens in the first few weeks or a month or two after surgery. So we can really get a sense very quickly during surgery exactly what position we want, what's going to look really natural.
Yeah, and I think that's really one of the important things if you're coming to somebody who's doing otoplasty for you, is that expertise, is that sense of knowing the aesthetic and being able to talk you out of overcorrection. A lot of patients, I think it's one of the prime examples we use is, if your ears have always been sticking out, sometimes they come in and their initial sense is, I want to be really pinned back, and our job is to kind of talk them out of that and saying, you don't really want that seal deformity really set back, excessively look. And that also has a lot to do with the surgeon's expertise in knowing how not to overcorrect and when not to take it.
Yeah, what we tell patients is that really the goal of surgery is for the ears to look so natural that they become a background feature. In general, as we're walking around and seeing people, meeting people, ears are not the first thing that you should notice about someone. And if you're noticing ears, it's because you feel like your ears are really prominent, they're too large, they stick out too much. The goal is not to stick them right back to your head. The goal is to just take them out of the horizontal plane and bring them back into a vertical plane with your scalp, where they just kind of disappear and become a background feature.
Great, thanks a lot.